it's Katie Signs. Today I'm going to be doing a sterile wet and dry wound change. So I'm going to go into the room, I'm washing my hands for 20 seconds, and then I'm going to identify my patient. I'm going to ask him what his name is and his date of birth, and then I'll confirm with the wristband. And I'll explain to him that I checked my orders and that he is due for a wound change. I'll explain to him if he has any questions, and then I'm going to ask him what kind of pain he's in. Flat Stanley has indicated that he is an 8 out of 10 on the pain scale, so I checked his orders and made sure he's not allergic to anything before I even give him any medication or before I start my wound care. Luckily, he's not allergic to anything we're using today, and I would give him Percocet as doctor's orders, and then he would take that, and then I would leave for about 30-45 minutes to wait until his pain level went down. While I'm waiting for that, I can check and make sure I have all of my supplies. So I do have my wound, my dressing tray, and then I have the tape, the bag, a swab to see how deep the wound is, a measuring stick because I do not have a measuring tape to measure how big the wound is, so that's what I'm working with. And then I have made, since we don't have the don't ignore my boyfriend if you hear him in the background.
Yeah, you're on your own, dude.
But sorry. But I also have my wound irrigation stuff because we don't have it. I had to make it. So I'm using the plunger from our catheter kits and a small little mason jar that I have, and I'm gonna pretend that's all in one. And then this is gonna be my saline. This is actually hand sanitizer. So I see why it's important to check if it's saline, because this does not look like hand sanitizer. But yeah, so before I would, while he was in the room, I would do my first check of the saline because I would be getting my stuff ready. And I would see that it was saline because this is technically a drug that would need 3 checks before we could use it, 3 verifications. Check the expiration date and it's not expired, so I would do that. And then I'll do my other 2 checks while I'm in the room, just because I know I have to pour this out and I would want to check it before I pour it, and then like twice before I pour it. So I'm going to put that back on my tray. I know you never turn your back to the sterile field, so I have everything on the side. Everything's kind of miniaturized because I didn't have the right kind of stuff to, do it the way you're supposed to. But here, I'll show you Flat Stanley. This is Flat Stanley. He is made from a yam and a few other things, but I thought it was funny. So I came back into the room. I'm gonna wash my hands again because I probably went and did some other stuff. And then I'm gonna ask him his name, his birthday, his name one more time, and then I'm gonna ask him where he's at with his level of pain after I check his wristband. He said he's at a 3, so we can start the sterile wound change. Okay, so now that Flat Stanley is pain-free, we're gonna start our procedure. So first we would bring the bed to waist level because anything below waist level is not sanitary or sterile. And then we would lower the guardrails so we wouldn't have to lean over those and hurt our back. So I did all that, and now I'm going to put my gloves on. Just regular gloves, not sterile gloves. So these need to be put on normally. These ones are kind of large, but that's okay, we'll work with it. So now we are going to let Flat Stanley know that we're gonna ask him if it's okay if we put the trash bag next to him. He said that's fine. So we'll open up our bag. Okay. So now I'm gonna get a different camera view. Hold on. Okay, so now we exposed only as much as we need. So we're gonna put the bag next to him. We'll pretend that's next to him because the bag is much larger than Flat Stanley. So, and then we're gonna expose as much as we need. And that's his blanket. We're gonna fold it down. And okay, so now that we expose as much as we need, we're gonna gently take the tape off. It's stuck to me, hold on. And then we're going to take the tape off this end. And we're gonna take it one layer at a time, pulling it towards him. So we're gonna take this layer off. I didn't have any of the supplies, so I kind of had to make it work with paper towels. So they kind of got stuck. Hold on. Okay, so we would examine the gauze for any odor, discharge, color, and how much is on there. So the first layer looks good. Second layer looks good. Take out these two. And we're gonna remove the packing now. So, packing is a little wet. Does have a lot of discharge on it. But that is okay. Has a little bit of a yellow color, but not as an infection. So now we're gonna examine the wound. We're not gonna lean over it, we're just gonna look at it. He doesn't have any redness or any signs of infection on the outside of the wound. He does have some granulation tissue on the inside, so it does look like he's healing pretty well. And I can see that there is secondary intention going on the inside. So he does have a good wound healing. Now we're gonna measure the wound. We're not gonna touch it, we're just gonna float over it just to measure and see how big the wound is. So his incision is 12 centimeters and it is 3 centimeters wide. Now we're gonna take a sterile Q-tip. This would be in a package and I would peel it open, but this is all I had, so this is what I'm using. And then we would want to make sure it's flush with the bottom, and we'd want to bring our fingers down to the opening of the wound and make sure that we're getting an accurate depth. So this is about how deep it is. You can't really tell because my gloves are a little big, but I can see it is about 3 centimeters deep as well, so that's pretty deep. And now that we've done all that, we're gonna get set for our wound irrigation. So now we're at the irrigation portion of this video. I would wash my hands again, and I would gather the supplies that I need for it. This is my saline from earlier. I'm gonna check to make sure it says saline and that it's not expired. If it was open, it would have 24 hours to be used, but luckily this one isn't open, so it's all good. So we're gonna put that to the side. We're gonna grab our plunger. This would be in a kit, and I would open it away from me, and then I would take it out. I could touch all the outside, but once it comes to the plunger, it's a little different. So here's my plunger, and here's my saline. Once again, third check, because it technically counts as a drug. So we're gonna check it again, read expiration date, and then we're going to, hold on. Okay, we're going to remove the plunger, only touching, it would have the circle part. But yeah, I would only grab the circle part. I would pull it out. I would open my saline, hold the label flat, and pour some in. Okay, and then I'm going to reclose it and replace this without touching any of the outside. All right, so that's set up. I'm gonna wash my hands again, and I'm going to put on my sterile gloves. So now we're gonna get our patient comfortable. We washed our hands, and we're just putting on normal gloves because this is not the wound packing part. So they can just be normal gloves. Alright. So So we're gonna position our patient in a manner that water would flow down. So when we irrigate it, the wound, he would tilt down. So we're gonna take, this is his head, but I'm gonna use it as a pillow. So I'm gonna put this behind his back so he's a little bit tilted. And then I'm going to put a, I'm putting this towards the video, but you know, in real life this would be facing me, but yeah, I want you to be able to see it, so I turned it. But this would be going underneath him a little bit, so he would not get water on his bed or himself. Flat Stanley, he's okay with this. So now here is my plunger. I would have a basin down here to collect the water, the saline. Let me see if I can find some. It's okay. So once again, I would grab this and I would suck some water in, and then I would hold it this way, so it's in between my fingers without touching any of the inside of it, and I would go down to the bottom, down to the bottom, and one more time so you can see a little better, down towards the bottom until it drained clear. The wound drained clear. So we'll do it a few more times just to get rid of the rest of the liquid in the syringe. And yep, that looks like it's draining clear. I'm going to absorb some of it just because for video purposes I'm going to suck this back in, but so that drained clear, and we're going to position him back to a flat state. I'm going to remove the pad, throw that away, and his blanket came off a little bit. Okay, so his wound has been irrigated. So now we're at the sterile part of the wound process. We're going to pack the wound, so that obviously needs to be sterile to prevent any bacteria from getting in the wound. And I did want to mention that before I would have irrigated the wound, I could have taken a culture to send down to the labs to see what kind of bacteria was growing in there, but I don't have that in my kit, so I didn't do that. But this is the inside dressing. I didn't get a kit for that either, but this is a paper towel, so I'm just gonna pretend this is it, and I would open it away from me. So that would be open. This would be in a container, but I don't have a container. And I would wet it down with a little bit of saline just to make sure that it's easier to pack. So now that that's wet, we are going to do our sterile gloves. So I made my own sterile gloves because I threw away the ones that we had. So these are 2 gloves inside a paper towel. They're folded like sterile gloves would be, so I'm just going to pretend like they are. So I would open it with a 1-inch sterile border. I would flatten it, only using the 1-inch side to flatten it.
Alright, let's go.
And then I would, hold on, okay. And then I would only grab the inside of the glove because that's the side that's going to touch my skin, and that doesn't have to be sterile. So I'm going to touch the inside. I'm trying to get it in the video, and I feel like it's I know it's going below waist level. I'm just trying to get you to see. And then I would grab the inside of this glove, the sterile glove, because that's the sterile side. Hold on. That's the sterile side. I'm going to put my hand in and hope it doesn't roll down. So, oh, it went right over my hand, so we're good. And then sometimes I pinch the outside of the glove to get it to flatten a little bit more because it bothers me. Okay. So now we have our sterile gloves on. Pinch this in the middle because that's the sterile part and throw it away. Now we're going to open up our dressing pouch. We're going to open it away from us and take out the sterile so we're only going to touch the 1-inch border, just like the gloves.
Dale.
Okay.
Go to that care package at the end.
And
you open it.
I don't know if it matters. She didn't say if it matters which way you put it down. But I'm gonna put it down this way. Sorry, cover the camera. And then I'm going to. We're gonna pretend it's in a container, even though it's not. Okay. So now that this is flat, I can touch the middle because it is sterile. We're gonna pull out what we need. So we have our swab sticks. She didn't use those, so I'm not going to. And then here are our gauze. I'm gonna separate them just so they're easier to grab when I need them. So she said we're going to need two like that. So I'm gonna use that. And then here's the big one. So I'm gonna put that one last because I need that one last. So that's my setup for that. And I'm never gonna turn my back to my sterile field. So it's going to be always on the side of me or within my peripheral vision. Okay, so now our sterile field is set up. Flat Stanley is ready, and we're going to start packing. So this is the inside. She squeezed hers out a little bit, and then she stretched it out. And then I'm going to fold it up, and I'm going to snake it in my hand.
Oh my god.
I'm going to grab the.
What was that?
I'm going to grab the. Turn and grab them. I'm going to grab the tweezers. Forgot the name of those for a second. And I'm going to start packing. So I'm going to make sure this doesn't touch the outside of the wound, because then you have to start over.
If you think you can try to make it, then you go for it.
I'm going to start packing now. Once again, this is a paper towel, so I hope it fits, but it might not fit all of my wound. It did when I did it the first time, but it looks kind of small now. Oh, it fit. Okay, so that's done. I'm gonna turn, and I'm going to take my two gauze, and I'm going to place them on top of my packing.
Right in front of me, dude.
This blanket wasn't full enough. That's it.
Right there, focus up.
My yam isn't big enough. I'm trying. And then I'm going to place this down. She said blue side up, and this no longer needs to be sterile now that the top is on.
Well, at least the game ended right there.
So I'm going to throw that out. We'll put some hand sanitizer on before I do the rest. And then I'm going to grab some tape. Hold up. Once again, sorry if you hear my boyfriend in the background. And then I'm going to grab some tape. I'm going to put some tape over the top of the wound. In the middle of the wound. And the bottom. I'm gonna write the date, the time, and my initials, and I'm going to put it on his dressing. So there you go. Flat Stanley is all set. So I'm going to throw out all of my unnecessary items. I'm going to recover him, ask him how his pain level is, lower after I throw away all the sterile items. I'm going to lower his bed back down and put the side roll back up and give him his call light. And then I would document everything. And yeah, that's the end of my video.